Hi, Namaste all. I'm Dr. Sai Prasanth Neti, Chief Consultant and Founder Director of Dr.Neti Skin Hair and Nail Clinic, Panchakutta and Amirpet. Today we'll discuss regarding hyperpigmentation or dark spots. So this hyperpigmentation or dark spots is basically due to two reasons internally, like what is the happens in the body if there is a dark spot outside. So is due to the increase in the number of the cell layers, or it is due to the increase in the melanin pigment. Sometimes together also, like if the person has a little BMI on the higher side, there will be increase in the number of cell layers. At the same time, there will be increase in the melanin also. Usually we call this as acanthosis nigricans, the darkness in the neck or groin or underarms. So normally due to other causes, the pigmentation will be due to the increase in the melanin. We will discuss regarding the various causes of this hyperpigmentation. So one is sun exposure or blue light exposure. The second one is vitamin deficiencies like B12 or vitamin D. The third one is any issues like thyroid or PCOD. And the fourth one is due to injury, post-burn injuries or normal other traumas like normal post accidents also we can see hyperpigmentation. And the fifth but not the least one is due to the use of OTC creams and cosmetics. So these are all the reasons, most common reasons for the hyperpigmentation. So discuss regarding the first one, sun exposure or blue light exposure. Nowadays there is a lot of exposure to the blue light, especially through the gadgets, the mobile phones or your computers or laptops. This can also cause aging and pigmentation also. And if you already have a small dark spot, it will also increase in the size due to the exposure to the blue light. So it is mandatory to use sunscreen if you are sitting in indoor also, because most of the people are using gadgets. And most of my patients ask me like, a doctor, do I need to use sunscreen while going out? So the answer is, if you are indoor also, you have to use sunscreen due to the exposure to the blue light. And the second one is vitamin deficiencies, less hemoglobin or vitamin D deficiencies or vitamin B12 deficiencies. You can get pigmentation all over the face, especially around the mouth also. And the other thing is post injury, like post burn or post any other injury, blunt injury also, you can get hyperpigmentation. But the thing is, if you have burn injury, always get treated on the same day preferably or on the next day, because like if you use home remedies, the pigmentation sets in within few days and it is difficult to treat the pigmentation. And if the burn is deeper also, there are higher chances of pigmentation. And the other most important factor is the use of OTC medications. Most people use creams recommended by their friends or some other people except doctors. So what happens is, these creams may contain steroids. So steroid creams can initially make you better, but in the long run they cause skin hypertrophy and they cause skin atrophy and they cause photosensitivity and increase in the pigmentation. So friends, don't use medicines on the recommendation of friends or relatives. Okay, always consult a certified dermatologist. If there is a pigmentation which already sets in, so what you have to do? So there are many options available for the treatment, especially nowadays. If the treatment is recent and it is superficial, we can treat it through creams, and it is always preferable to use sunscreen, because sunscreen will not exacerbate the dark spots. And if the pigmentation is from many months and it is violaceous in color, then you have to go for any other procedures like to switch laser or chemical peels. So in chemical peels also there are many types of chemical peels. One is azelaic acid combination peel, other is glycolic acid combination peels, yellow peels, and cospenol peels. Cospenol peels is the recent peel. It is very effective in treating hyperpigmentation. So many people ask one more question is like, if you get treated for the pigmentation, whether it will come back again or not. So the thing is, you have to regularly use sunscreen depending upon your work style. So the answer to the question is, you have to use sunscreen regularly, and frequent application and good amount of application is also important in order to reduce future outcomes. Thank you all.